much for being here today. My name is Jasmine. I'm the lead organizer on the Medicare for All campaign for the nurses, and I'm gonna be your MC today. I am thrilled to be here on behalf of the California Nurses Association and National Nurses United, the largest union of registered nurses in the country. Let's hear it for the nurses! So the nurses have been demanding Medicare for all for literally decades, right? And there's a reason why. Nurses have a deeply up-close and personal view to how broken our healthcare system in this country actually is, right? And nurses are in the room with patients as they're making choices every single day between paying for a necessary procedure, filling an expensive prescription, or paying for their rent or their groceries. This happens every single day. And nurses know that the only reason this happens in this country is because of the massive corporate greed that sits at the center of our healthcare system, right? And so the nurses of CNA and NNU have known for a long time that Medicare for All, which is the system that would eliminate the profiteering insurance industry once and for all, is the only solution to this crisis, right? Now the pundits and the politicians, they want you to believe that there are multiple solutions to fixing our broken healthcare system, right? Yeah. But we know that there's only one real solution that guarantees healthcare to every person. One solution that contains skyrocketing healthcare costs. One solution that saves everyday people across this country money every single day by removing the billions in profits from the insurance and the pharma corporations. And only one solution that has a mass growing grassroots movement behind it, and that is Medicare for All, right? So we're in a moment where the tide has really turned lately, right? We are at a historic turning point for this movement, and that is what today is about, demonstrating the strength and the power of this growing movement. Now, since February of this year, we have been centering our fight on a specific bill in the U.S. House of Representatives. This bill is called H.R. 1384, the Medicare for All Act of 2019. Yeah. It's a great bill. And together with all of you here today and with thousands of volunteers and activists across the country, we have been building grassroots support for this bill all year long. We have gotten 119 members of Congress to co-sponsor it. That's half the Democrats in Congress. Co-sponsor Medicare for All. And we've gotten 3 historic hearings on this bill. But increasingly, as time goes on, it's up to House leadership to move this bill. And that's why we're here in downtown San Francisco today. Speaker Nancy Pelosi has tremendous power and influence in the House. She gets to decide what gets hearings, what gets markups, and what gets floor votes. And we are here today to call on her to move this bill. Now, you may have seen in The Hill yesterday reported that Speaker Pelosi said she's not a big fan of Medicare for All. But we're here to show her today just how many of us are big fans for Medicare for All, right? Yeah. I'd like to introduce our first speaker, Amy Erb, registered nurse and board member of the California Nurses Association. Please welcome Amy.
Thank you, and good afternoon. My name is Amy Erb, and I am a proud board member of the mighty California Nurses Association. I have been an ICU nurse for 16 years, currently at California Pacific Medical Center here in San Francisco. But I've also cared for patients from San Diego to Seattle to Mobile, Alabama. In all of that work, like every nurse across this country, I've seen the unnecessary suffering caused by our failed for-profit healthcare industry. How many people here are in your 40s? I'll admit it. Well, imagine then my patient who is your age, dying of a catastrophic stroke because, as her daughter told me, she had recently lost her job and could no longer afford to see her doctor or pay for her blood pressure medications. I've seen diabetic patients who've landed in the ICU for days, sometimes losing limbs or losing their eyesight just because they were rationing their too expensive insulin. I've cared for patients whose dental infections went untreated, traveled to their heart, and became life-threatening. I've overheard many families at the bedside agonizing about what that hospital stay was going to cost them, instead of being able to focus on their loved one's recovery. And I've seen way too many times to count doctors holding off on necessary procedures and treatments because they were waiting on insurance company approvals which sometimes never came. And this is patients with insurance. Those without coverage fare even worse. This is inhumane and disgusting. We nurses across this country live this heartbreaking reality every single day, every single shift. It's why we're fighting so hard for a single-payer, Medicare for all healthcare system. We know that healthcare should not be based on a person's income. Healthcare is a human right. I am so proud to be part of this grassroots effort to move this country to a more humane and effective healthcare system. When I'm not caring for my patients, I've canvassed, attended rallies, led local assemblies, lobbied lawmakers with thousands of everyday people across this country. And, as I hope all of you will do, I've spoken to everyone who will listen about Medicare for all. We are building this movement to unforeseen levels, using our collective voice to be heard by those in power. And that is why we're here today, in the home district, Speaker Nancy Pelosi, demanding that she hear our voices and move Medicare for all in the House. Nancy has shown lately that she has had the power to stand up. Well, we ask her now to stand up with us. Speaker Pelosi has recently said that she isn't a big fan of Medicare for all. That she thinks affordable care is better, but that she welcomes the debate. Well, Speaker Pelosi, there are hundreds of people here today and hundreds of thousands across this country who would like to take you up on that offer to debate. Because we know that affordable should never be a word in relation to healthcare. Because it should not be about profits. Healthcare is a human right. Progress in this country has always been the results of mass movements of everyday people. Everyone here today is part of this mass movement for Medicare for all, and we are making history. So let's stay loud, let's keep organizing for our patients, our families, our communities. We can't give up. There is too much at stake. And seeing all of you incredible activists here today, I believe that we will win. Let me hear you say it with me. I believe that we will win. I believe that we will win. I believe that we.
Next, I'd like to introduce our next speaker, Kung Fang, the Executive Director of San Francisco Jobs with Justice.
Let me tell you a story about why I believe in Medicare for all. I have a school picture. I'm about 3 years old. I'm smiling into the camera. I have a big smile, and right in front of my teeth, I have this 2 silver teeth, and they're to prevent cavities. And my way my mom tells it is that I went to Head Start one day, and then all of a sudden I came home and I had 2 silver teeth. Basically, there was a public program and it allowed me to see a dentist. Even though my mom was a single mom, she always made sure that my health was taken care of. And now I have a 3-year-old son myself. 3 days a week, he's over there with my mom. And my mom has this special toothbrush and she brushes his teeth. She has this special floss just for kids and she flosses his teeth. She has this water jet machine and she uses that to clean his teeth, right? You could say she's kind of obsessed about teeth. So the thing is, if you look at my mom's teeth, if you look at her teeth, they're stained, they're chipped, they're crooked. And that's because when she went to the dentist with me, and the dentist said, "You need to take care of your teeth," she said, "No, I can't afford it. Please, take care of his teeth, not mine." So this story is about teeth, but it's also about medicine, it's about surgery, it's about all the moms in this country who, just like my mom, they're having to make that choice to sacrifice their health so that their kids can be healthy. The reason why I'm telling you this story is because people who oppose Medicare for All, they like to talk about choice. They say there's a free market and it gives us choice. Let's talk about choice. Let's talk about the moms who are going without health care so their children can have health care. Is that a real choice? Is that a real choice? Medicare for All is the real choice. That's right. And we're here today. We're here today. How many of you all have been fighting for Medicare for the past year? How many of you all have been fighting for 5 years? For 10 years? That's right. Ever since Childless Justice was founded 9 years ago, we've been fighting for Medicare for All. We've been fighting to save St. Luke's in the city. Anybody? Save St. Luke's? Fighting CPMC? Right? We've been in this because nurses have been on the front lines, because that's what you do every day, is that you fight to keep us healthy. And now we have Medicare for All in the Congress. We have more and more people supporting Medicare for All, 70%. We have presidential candidates putting it on their platform. And now it's time. It's time that healthcare is about taking care of people and not taking care of profits. And it's time that Speaker Nancy Pelosi make her choice, right? We've made our choice. We've chosen that every mother, every father, every person in this country, and every child should have Medicare for all. That's our choice.
We have the great pleasure of being joined by Ola Ujawumi. Ola is a patient advocate who has traveled all the way here today from Washington, D.C. To share her incredible story with you. Please welcome Ola.
Good afternoon. Thank you so much for that introduction, Jasmine. My name is Ola Ujawumi, and I'm honored to speak in front of you today as the founder and director of a small education nonprofit called Project Ascend. We provide college scholarships to disabled students, and I'm here today in support of Medicare for All. At age 9, out of the blue, I was surprised with a diagnosis of a random heart condition called hypertrophic cardiomyopathy. 2 years later, I received a heart and kidney transplant. Now, since then, I had lived a relatively healthy life up until I turned 19 years old. And I was told that I had cancer as a result of my organ transplants. It wasn't until I was 24 years old where I could receive cancer treatment at Johns Hopkins. Because of the Affordable Care Act, I was able to stay on my parents' health insurance to receive cancer treatment. I'm now 28 and living cancer-free. I have health care through my employer now, but still I'm terrified of losing my health insurance due to efforts put forth to block health care reform and Medicare for all in Congress. At any point, I can be priced out of my health insurance plan. I take about 22 pills a day, one of which helps keep my transplanted heart and kidney functioning. Without insurance, that medication could cost me $2,000 a month. A few years ago, I had to stop taking a medication for my muscular disease that has put me in a wheelchair because it became too expensive at $400 every 6 weeks. That's why Medicare for All is so important. So many people across the country rely on programs like Medicaid and Medicare. A number of my friends and colleagues have disabilities and they rely on Medicare waivers to afford their health care. H.R. 1384, the Medicare for All Act, would revolutionize health care for disabled people like me by changing from health care being a luxury for a few into it being a reality and universal for every American. Healthcare should never be a luxury a few can afford, and Medicare for All will guarantee healthcare for everyone free at the point of service. Despite my disability, I've been able to do incredible things like start my own nonprofit at 19. The potential of people with disabilities is limitless. If they can get the care they need, they can do anything in this world. I don't know how I would survive without health care. I'm tired of worrying every few weeks about what's going to happen to my health. I regularly fear for my future. It's exhausting to have to tell my story time and time again to show our lawmakers the human impact of their heartless proposals. The United States is one of the wealthiest countries in the world. We should be able to afford health care for every single person who needs it. My life is not less valuable because of my disability. Life does not end at disability. People like you and I have a right to health care that will allow us to reach our potential, to contribute fully to our communities and to society. I refuse to be a casualty in the callous efforts to roll back protections for the most vulnerable in our society to benefit those at the top. It's time to make Medicare for All a reality for the present and not a dream for the future. Thank you all.
The pleasure of welcoming Dean Preston, who is a tenants' rights advocate, founder of Tenants Together, now candidate for San Francisco Supervisor District 5, and endorsed by the California Nurses Association. Please welcome Dean.
Hey everyone, I am Dean Preston. Thank you, Jasmine. And what an honor to follow Amy Erb and Kung and Ola, and I'm so happy to be here with all of you today. We know that certain things like housing and healthcare are human rights. Healthcare is a human right. Healthcare is a human right. Healthcare is a human right. And housing is a human right too. And let's be clear, no two things could be more intertwined, more interdependent than housing and healthcare. Housing is healthcare. People in stable housing are healthier. And people with guaranteed healthcare remain housed. And at a time when 70% of Americans support Medicare for all, and when the nation is hungry for bold solutions to our most urgent problems, let us all, and that includes you, Speaker Nancy Pelosi, let us all come together and support the Medicare for All Act of 2019. The time is now. No more delays, no more excuses. We cannot wait. Medicare for All will save trillions of dollars, and more importantly, it will save lives.
I know, I gotta run. I wanna see how much. Insurance companies got to go. Insurance companies got to go.
We need Medicare for all today! We need Medicare for all today! Dying. Maybe we could do it. Jackie Gleason
A lot of them last year when I was fostering some kittens with ringworm. We trimmed them with and I never did. You needed to.
Hey! Oh no! Insurance companies got to go! Insurance companies! Hey! Oh! Insurance companies got to go!
Everybody in! Everybody in! Everybody
Mighty, mighty people!
Mighty, mighty people!
Power to the people!
Power to the people!
All power to the people!
Power to the people!
Medicare for all!
Medicare for all!
Medicare for all!
Medicare for all!
Power to the people!
Power to the people!
Medicare for all!
Medicare for all!
What do we want?
Go!
Insurance companies got to go!
Insurance companies got to go!
Insurance companies got to go! Insurance companies got to go! No money out! No money Kardashian.